Twin brothers, Dean and Luke Kolozajak, are typical 2-year-olds. They like to climb,
You gonna do it?
try to outrun their parents,
Hey, slow down!
and dig in the dirt.
Luke, are you going to be a gardener?
But their lives started out as anything but typical, weighing just 2 pounds each when they were born.
They had respiratory issues and they had a brain bleed and some other health issues, so they were being fed through a tube, and then one of them was still on oxygen when they came home.
Just watching your kids struggle and fight for their lives in the hospital and hooked up to machines, it's just something you never want to see your children go through.
Dean and Luke spent nearly 6 months in the hospital before Jenna and John were finally able to welcome them home. That was December 2019.
Then we found out about the pandemic, and it was really scary. Really, really scary. We couldn't let people into our house. Friends, family couldn't come and meet the boys. They had to quarantine, they had to wear masks, they had to test.
Physically, socially, locking down ever since the early days of the pandemic in an effort to protect their children.
We can't control a lot when it comes to their health, but we can control exposing them to the coronavirus. Good job finding bugs.
For them, the decision is easy. They're going to be at the front of the line for the COVID-19 vaccine for little Dean and Luke.
This is going to hopefully help ease things into a more normal state, we hope.
But only 18% of parents with children under the age of 5 feel the same way. 27% of parents say no way, and about half of parents fall somewhere in between. One of the biggest reasons for hesitation is that kids aren't very likely to get sick or die from coronavirus, which is absolutely true if you compare rates to adults. But what if you just look at kids all by themselves? Since the beginning of the pandemic, more than 480 children under the age of 5 have died from COVID, and over 1,500 children and teens under the age of 18 overall.
When you compare COVID to other risks that children face, whether it's influenza or other infectious diseases, COVID can be quite serious. And so the right comparison isn't the child versus the elderly person. The right comparison is, how does COVID compare to other risks for which we vaccinate? And in that context, it's really not a close call.
To give more context, before vaccines in the 1960s, approximately 440 adults and children died every year from measles, 39 people from mumps, 17 from rubella. And yet, we routinely vaccinate against all these diseases. They are called vaccine-preventable deaths, one of the biggest triumphs of modern public health. It's also true Dean and Luke were born with pre-existing conditions, placing them at greater risk for severe COVID. And as many as 62% of all kids hospitalized with COVID had an underlying condition. But those underlying conditions are also widespread. 200,000 children with diabetes, 6 million with asthma, and 14 million children with obesity. Another concern of many parents is that the mRNA COVID-19 vaccines are new. Also true. So far, though, nearly 600 million mRNA COVID vaccine shots have been administered in the United States, and side effects have been rare. For John and Jenna, getting their boys vaccinated won't just be a relief, but a chance to live a life they felt was passing them by.
We were at my sister's house recently for their cousin's birthday, and they wanted to go inside and play in the playroom. And we're trying to tell our kids no, but they don't understand, and that's hard for us, it's hard for them, it's hard for our family. We've missed a lot of family holidays.
Yeah, the last 6-8 months folks have been traveling, doing things, so it's almost, we've been more detached from them because we've still been in the same bubble waiting for the boys to be able to get vaccinated.
Dr. Sanjay Gupta, CNN, reporting.